So next, we are going to have a panel entitled How the News Media Informs How Americans and Their Elected Officials View What Makes Us Healthy. So if I could ask the participants to come forward, and I'll kind of say who's coming. Our moderator is going to be Ceci Connolly, Managing Director of PricewaterhouseCoopers Health Research Institute. Michelle Levender, Director, USC Annenberg, California Endowment Health Journalism Fellowships Editor. Reporting on Health.org, co-editor of Broyle Heights Beat. And Kate Long, former reporter, Charleston Gazette, co-director, Try This West Virginia Project, West Virginia Healthy Kids and Families Coalition. And Karen Buffard, reporter for Detroit News. So as you can see from that brief overview, here we have an exciting panel to talk about the news media and how the news informs how Americans and their elected officials view what makes us healthy. So Ceci, I'll turn it over to you. Certain I don't take any lines.
Leave me the secret notes.
Yes, okay. Okay.
Just the good cheat sheet.
Just the good cheat. Okay.
Good morning, everyone. Thank you, Sani, for that kind introduction, and thank you, those of you who are here in person, and also those of you out in cyberspace. We would love for you to send some questions or comments, or tweet if you're on Twitter. I've been following some of the discussions, so please do tune in if you're a multitasker, as most of us are these days. I was flying out here from Washington yesterday, and I'm old school, so I was reading that old-fashioned thing called a newspaper, and I actually tore it, and you can see it's kind of jagged, and remember those old days? But I wanted to read a little, just 2 paragraphs from a story that caught my eye, and at first you're going to wonder what this has to do with population health, because the headline is Scoring Drugs for the Medicare Set. And it's a great piece. I recommend it. It's a woman describing her 80-year-old mother who has a little bit of heart trouble and put on some very expensive heart medication, and it's all going very well until one day the father says to the author of this piece, "Your mother is in the donut hole." My 83-year-old father said to me grimly. I had no idea what he was talking about, but knew from his expression it was not a good place to be. I instantly pictured my mom encased in a giant inner tube of fried flour, uselessly trying to eat her way out like a doomed character in Willy Wonka's chocolate factory. So right there, I think, is an illustration of the challenge for the vast majority of journalists that write anything about health or health care. And while Medicare Part D isn't quite population health, I love the fact that the donut hole has become accepted healthcare jargon in Washington and in the medical community and in the insurance world and everywhere else. And it also underscores the challenges in writing about these topics. Now, fortunately, if you find a good journalist, they then write this paragraph following. I quickly learned that the quote-unquote donut hole has nothing to do with baked goods and is instead the term used to describe the gap my mother had now reached in her Medicare Part D prescription drug program. She had hit her initial coverage limit of close to $3,000 a year, calculated by adding together the full fee of all her drugs, and now would have to pay a higher out-of-pocket cost for her prescription drugs until she reached the catastrophic coverage threshold thousands of dollars later. Now, this is not necessarily Pulitzer Prize-winning journalism, but I do think that it's pretty fine, responsible journalism. And it gives you a good illustration of the power of the media to help translate jargon, complex concepts, data, numbers, math, crazy programs like the Medicare Part D donut hole, which makes no sense to anyone except for Tom Scully because he knew that he only had so many federal dollars to play with, and that's why he had to create that. And so to me, when I think about the beloved institution of journalism, which I was in for 25 years, that is a little snippet of what journalists can do when they do it well. And the reason that it's relevant to all of you is you need to help them do it that well. Very few journalists today get paid much money, are given much time, or are trained in medicine or science or statistics or economics or any of the other complex behavioral health, everything that you just heard from Bob today. Most journalists get their start covering fires or selectmen's meetings like me up in New Hampshire. They work their way up to the city council. Maybe they cover a congressional race. And they might eventually get around to writing about health. But they're almost never formally trained in these concepts. And population health, while it sounds very simple, as you know, has many layers of complexity to it. And so what I'd like to do as I introduce our panelists is to kind of keep that in mind in terms of what are the ways that we can all work with the journalists to really further some of these causes around educating, activating the public, trying to get them to think about behavior change, whether it's on the individual level, whether it's on the broader community level that population health sinks in with so much. Understanding the different roles, understanding what journalists are up against, how you can properly work with them within some ethical confines that I'd like to touch on today. Because I think when it's done right, it's incredibly powerful. So we're going to have a wonderful panel here this morning, and I think that what I'd like to do is just tell you a tiny bit about what I see tying the three of them together. When I think about these three women and their careers, and specifically some of the journalism that they want to share with you today, what really comes through is that this is journalism with impact. And a lot of us in our careers strive very hard for the story or stories that have real impact. It's not easy. I can tell you, I used to have stories on the front page of the Washington Post all of the time, and I was quite confident that it was such a compelling story, and of course it was so well done, that immediately the world would change once they had a chance to read this article that I wrote. Whether it was about vaccination campaigns, or the SARS outbreak, or the cost of certain medical procedures, or Geisinger and the amazing things that they do there, or Health Partners is another one. I was quite confident that all it was going to take was one wonderful story on the front page of the Washington Post, and everybody was going to get it immediately. And unfortunately, that's not the case. It's very hard to have impact in today's world, especially when you think about 24/7 news, Twitter, the diffusion of information. And these women have stories of impact to share with you, and that's a real accomplishment. The next thing that really strikes me is they don't come from big, wealthy, deep pockets news organizations. They come from news organizations where the staffs have been slashed, where nobody makes much money at all, where everyone is stretched thin. They rarely have the leisure of time, and yet these individuals, the fellowship program that Michelle is going to tell you about, and some editors made real commitments that are unusual and really speak to their dedication to the topic of population health. And finally, what strikes me is that they each get at the core of population health, whether they ever use that term or not. And in the earlier conversation, we were saying how when you used to Google population health, a couple little things would come up on the screen. Now it goes on for pages and pages and pages. And if I asked every person in this room, if I put a gun to your head and said, write your definition of population health on a note card, I bet I would get at least 45 or 50 different definitions right here today. And this is an expert group. So whether or not they use that term or they use that term precisely in the way that you think they should or you would like, they are getting at the core messages. And that to me is very, very important. So with that, I'm going to introduce each of them as they do their presentations. We're going to begin with Michelle. And you have full bios, so I won't go on and on, but Michelle directs the California Endowment Health Journalism Fellowships at USC and also edits reporting on health.org. And really, I have to personally thank Michelle for what that organization is doing for good, high-quality journalism. We certainly need this kind of support, and it's critical to the future. So, Michelle.